Hi, I'm Dr. Samantha. I'm a board-certified psychiatric nurse practitioner with over 13 years nursing experience, working in mother-baby postpartum, NICU, antepartum, and labor and delivery. I'm also an IBCLC, I'm perinatal mental health certified, and maternal newborn nursing certified. Sex is an important part of a healthy relationship, but pregnancy sex can be very scary for couples. Today is the second part of a 3-part series about sex during pregnancy, where we'll be telling you everything you need to know about sex during your second trimester of pregnancy and how to make it great. So click those like and subscribe buttons and stay with us. Your second trimester is between weeks 14 and 26. So this is a great trimester for most couples for sex. Many of the unpleasant side effects of pregnancy during the first trimester have disappeared. You will often have more energy and an increased libido. That means an increased sex drive. Your belly is still small enough to experiment sexually, and you have increased blood flow to your organs, which can increase your chances of having orgasms and pleasure during sex. You still may have some vaginal dryness and issues with a full bladder, but everything else is usually good to go. During your second trimester, you can have loads of fun. This is the time to have sex at different times during the day and experiment with different positions. Make sure you use lots of lubrication. Water-soluble lubrication is best because it has less chemicals. It's also easier to wash off. You also want to avoid warming products, flavorings, glycerin, fragrances, and parabens because these could cause infection or irritation. Many couples are concerned about safety during pregnancy. So sex is safe in a healthy, uncomplicated pregnancy. It does not lead to miscarriage or preterm birth. It promotes connection between the partners, and the hormones released during sex can help relieve pregnancy discomforts and ease stress. Anal sex is okay during pregnancy, but just remember, if you've had anal sex, you cannot re-enter the vagina without washing up first due to the increased risk of bacterial infection. Please remember to hit the like and subscribe buttons so you can get our latest content. There are many ideal positions to use during sex in your second trimester, starting out with standing. So standing is exactly what it sounds like. You're standing and usually your partner comes in from behind. This is something that's very ideal because it allows for shallow penetration and a slower pace. It also avoids pressure on your belly, and you can lean on a wall, chair, or countertop for comfort. Another one, which is commonly referred to as cowgirl, is where a woman is on top. This is ideal because your hips don't have to open as wide, and it's very common to start to have hip pain in the second trimester. You're in charge in this position. You have in charge of depth, the pattern, the rhythm, and studies have shown that this is actually more sexually pleasurable for many women. Reverse cowgirl is simply that you are on top looking away from your partner. And finally, chair sex is also ideal in the second trimester. This is where your partner sits on a sturdy chair or surface and you straddle them. You can face each other or face away. Make sure, starting in the second trimester on, that you no longer lay directly on your back because this puts pressure on the major blood vessels in your body and it can be dangerous for you and the baby. Here are some tips for having great sex during this trimester of your pregnancy. For starters, you can use sex pillows for positioning. You can also use your pregnancy pillow for the same thing. Vibrators and sex toys are safe during pregnancy, but try to use a higher quality material such as glass, silicone, or body-safe latex. Make sure that you're cleaning your toys well and use a lubrication that is safe for them. Finally, you want to check the settings on your toys because your clitoris becomes very sensitive during pregnancy and your normal settings may be too much. There are several reasons why you may not be able to have sex during pregnancy, and your healthcare provider should be letting you know some of these. For starters, if you're having any heavy bleeding or placental issues, including a placenta previa, which is where the placenta sits over the cervix. Also, if you have premature rupture of membranes, which means your water broke early, or if you're having any trouble with your cervix, like early dilation. If you're pregnant with multiples, like twins or triplets, you may not be able to have sex. Also, if you have any active sexually transmitted diseases or a history of preterm labor. Finally, if you're being told that you cannot have sex, it's very important that you also clarify whether you're allowed to have an orgasm. A lot of times you are allowed to have orgasms, which means you can masturbate. You're just not allowed to have vaginal penetration. I hope this video has helped you learn everything you need to know about great sex during your second trimester. Please share your comments and let us know what topics you would like to hear more about. Remember to hit the like and subscribe button so you can get our latest content in pregnancy, labor, and early childhood parenting. Share this video with your friends and family and follow us on Facebook, Instagram, and Twitter for additional content. We will link those in the description below. Thank you so much for joining us at the Maternity Mentor.